that would be a conversation for a group of people, cardiology, neurology, and the family, because you risk a brain bleed also. Now they have a stroke, right? And we have abilities to go in and actually retrieve this stroke. I think end up getting a cerebral angiogram, and they go and they can actually retrieve the stroke. In somebody like this who has a high risk of bleeding, having had all these anti-platelet drugs on board, I think it will have to be a very intentional conversation, because you risk hemorrhagic conversion. Then now it becomes not just an ischemic or embolic event, now it becomes a brain bleed. You have to crack the skull and all that, right? So I think if there's opportunity to retrieve the clot, I don't know if they do that here. Do we do cerebral angiograms and just like you would do if there was a clot anywhere else and remove it? I don't know. They do that here? Then I think that would be the choice for this patient. But I am a cardiologist. And I love being a cardiologist. I like cardiology. Okay. All right. I think I have one more case. So this was a 32-year-old woman, G2P1 at 30 weeks, coming with shortness of breath and syncope. Bowing of the central leaflet. Diastole is when the left ventricle fills, right? So when the mitral valve opens, it's supposed to open wide and blood flows in. In this case, the medial portion is moving, but the tips are not. MRI. MRI is very helpful for cardiac MRI. If you look at the for vasculature, you look at the tissue densities, right? In echo, I can't say, because even a thrombus will look just like your soft tissue. So I can't say this is we'll call like echo bright or echo lucent structure, that this is actually a mass versus a thrombus. But he had multiple lesions all over his body. He had Carney syndrome, and when we did a biopsy, it was myxoma. He had myxoma in the skeletal muscle too. I think 2 months ago, they actually talked about what should be in an echo report and how you should frame your echo report. I tell this to my trainees all the time, is that you have to know your audience. It's more confusion if I start writing stuff that only cardiologists know, right? So when you get an echo, I don't know how you guys do your reporting here, but there's a standard. Okay, normal. It is completely normal, right? It's just the word malformation, right? So writing, we have to be very careful. So I'll say first of all, I will not say anything, because it's not helpful, right? It does nothing to the patient. Something that needs to be